Now, of course, anybody who has injectable fillers put in their face has a lot of questions, as they should, about how the treatment is done and about safety, and it's important to recognize that Radiesse is an FDA-approved filler, so it's been appropriately tested to be safe. I love using this product because, as you saw in the previous slides, there's immediate improvement after the product is injected, and there's nothing more gratifying to a physician or a patient to be able to come into the office, have a treatment, and to be able to go home. Excuse me one second. I'm back with you. Sorry about that. And to be able to be treated and to be able to go home with immediate improvement in the areas of concern. So I love Radiesse also because we can now mix it with local anesthetic, which makes the injection almost pain-free. And also because we're mixing it with the local anesthetic, we do not need to do any kind of facial block the way we do with the other injectable fillers. Patients can usually return to normal activities after the treatment, although I generally recommend that you refrain from doing any high-intensity aerobics for about 45 minutes. For about 48 hours or 2 days after the procedure, so that you don't get a whole lot of facial flushing, which can increase swelling immediately afterwards. Again, clinical studies for the FDA approval have examined over 1 million treatments performed worldwide, and so we know that Radiesse is safe and very well tolerated. Anytime we stick you with a needle, there can be bruising and there can be redness. We don't expect the bruising to happen, but it does happen, and a bruise can take as long as up to 2 weeks to resolve, depending upon how you heal. But the redness usually resolves within 24 hours. Swelling usually resolves relatively quickly, too. There is a risk of infection because we're putting something through the skin, and the skin's your natural defense to bacteria. But I personally have never had an infection related to Radiesse, and it's a very, very unusual situation. So again, we're talking about keeping patients comfortable while we're making them look better. And as we spoke about briefly before, we now have the ability to mix local anesthetic directly into the Radiesse. And this approach has been FDA approved, and it has made injecting the Radiesse much more comfortable for patients. And as we see here, 90% of the patients experienced a significant reduction in pain by using by mixing it with local anesthetic.
Dr. Lee, before we move on, we do have a couple questions.
Sure, go ahead.
One is, are there any long-term side effects of Radiesse?
We're not aware of any long-term side effects. I have found, however, that patients who keep up with their Radiesse, so will come in for touch-ups, maybe within a year, not waiting the full year, need less injectable over time. So although it's never been demonstrated what that exact mechanism is, I do need to inject less, and patients seem to have better retention as we keep up with the injectables, as opposed to waiting for it all to disappear and then getting retreated again from scratch.
Great, thank you. And another quick question about the difference between Radiesse and other fillers available on the market.
Well, Radiesse, again, is made of a calcium-containing product, and the other fillers on the market are the hyaluronic acid fillers. Hyaluronic acid is a gel substance which is present in all your joints and as part of your cartilage, and those fillers work differently than the Radiesse does. There are also other fillers like Sculptra, which is made of polygalactic acid, and it's also a foreign substance, not native to the body. And Sculptra is used very differently than either the hyaluronic acid fillers or the Radiesse. In addition, there are collagen fillers that are available, but in my practice I'm not using these anymore. I much prefer Radiesse or the hyaluronic acids.
Great. And what is the difference between Radiesse and Botox?
Excellent question. They address two completely different areas. What Botox or botulinum toxin A does is relax the muscles of facial expression. So when we use botulinum toxin A between the brows, what we're actually doing is preventing the muscles that make you frown from being able to work. So Botox smooths areas like between the eyebrows by relaxing the muscles. What Radiesse does is fill a wrinkle that exists even without any facial movement. So all of the fillers are used to fill creases which are present when your face is completely relaxed. The botulinum toxin A's are used to relax the muscles that make the wrinkles.
Great, thank you. We have a couple more questions, but you'll be addressing them as we move on.
Okay. So we're kind of recapping and looking at areas in which it's appropriate to use Radiesse. Again, it's FDA approved for the correction of facial wrinkles and folds, predominantly around the mouth, as you can see in this picture. So they're calling the nasolabial folds the smile lines on the left. It's also possible to use Radiesse in the corner of the mouth where the mouth starts to come down and make us look a little more sad as we age. It's appropriate to use in the line that can run from the corner of your mouth down to your jawline, which is affectionately known as the marionette line. And it's also possible to use Radiesse as a filler and just to the side of the chin where the jowl can actually make a notch between the chin and the cheek.